So good evening and a warm welcome to all the viewers in this third session of ongoing series of Cancer Talk with Dr. Minish Jain. In this series of Cancer Talk today, we are going to discuss about one of the most common cancer worldwide, which is lung cancer. We would also talk about how to prevent and manage lung cancer and what are the things that we should know about lung cancer, and to guide us through all this thing. Once again, we have with us respected Dr. Minish Jain, the Director General Medical Oncology at Ruby Hall Clinic, Pune. Welcome, sir, and thank you for
Thank you,
joining us.
Ashish.
Also associated with KEM Hospital, Pune Hospital and Research Center, Jahangir Hospital and Medical Center, and also Noble Hospital. He has numerous publications in national and international journals and has received many prestigious awards and recognitions as well for his contribution towards oncology. If you have any questions which is related to cancer, you can visit sir's own YouTube channel named Cancer Talk with Dr. Minish Jain. And you can also visit his second channel, which is Spotify, named कैंसर की बात डॉक्टर मिनीश जैन के साथ. So without any further delay, my first question, sir, what is lung cancer?
See, basically, lung is a spongy tissue which is situated in our chest. It has got a right lung and a left lung. The right lung has 3 parts. The left lung has 2 parts. The main purpose of lung is to take oxygen in and exhale carbon dioxide out. When you get a cancer happening in this area, it is called lung cancer. And this is one of the most preventable cause of cancer. Basically, 80% of non-small cell cancer and 90% of small cell cancer is related to smoking. So if there is no smoking in the world, probably 80 to 90% of cancer will be out. And this being the largest killer means if you put all breast cancer, colon cancer, and prostate cancer together, all their deaths are less than lung cancer alone.
So what are the various types and of lung cancer, and which is the most common among these?
See, basically, if you look at lung cancer, then there are 2 types of major lung cancer, basically non-small cell lung cancer and small cell lung cancer. Non-small cell accounts to almost 85% of all cancers. Non-small cell comprises of adenocarcinoma, squamous cell carcinoma, large cell carcinoma, and non-specific types. And small cell is around 15%. There are many other subtypes. Actually, if you go in details, we won't go in details of those, but then those are adenoid cystic carcinomas, sarcomas, lymphomas. Those are very rare types. We won't go in details of this. But majorly, remember, there are 2 types, adenocarcinoma, squamous cell carcinoma, and large cell carcinoma, non-small cell and small cell. In non-small cell, adenocarcinoma, females are more affected and non-smokers are also more affected. They are peripheral cancers and they are generally mucin secreting substances which are creating this adenocarcinoma. So the peripheral mucin secreting are adenos. The flat lining and the central lining, which is because of the smoker's lung, is squamous cell carcinoma, and large cell carcinoma is an aggressive form of lung cancer, which is difficult to respond. In small cell carcinoma, you have either localized or extensive disease. So if it is localized, the outcomes are good, but 70% of small cell carcinomas present in advanced stages and 70% of them die of treatment, even after treatment. So it's a very aggressive form of cancer, which is related directly to smoking. 90% of small cell comes from smoking.
So what are the risk factors for lung cancer?
See, if you look at risk factors, smoking is the most important risk factor. So if you are smoking or if you are undergoing a second-hand smoke, if you are having an exposure to pollutants like air pollution, diesel exhaust, coke, fumes, means people working in coal mines, people working in having asbestos exposure, beryllium, cadmium exposures, having arsenic through water, or having pesticides, obesity, alcohol, all these are risk factors for lung cancer. There are many, and most important being smoking or second-hand smoke. Radon also is an exposure which is happening today because see what is happening. We are mining, we are digging the rocks, and the uranium breaks and releases radon. Now, that is also one cause of lung cancer. Significant number of cases happen in America. We don't have that data in India, but almost 5,000 plus cases are related to non-smoking and radon.
What about, sir, air pollution? Is it also a cause, major cause, we can say?
Yeah, it is considered that in cities, like especially urban population, are getting exposed to 5 to 15 cigarettes a day through diesel exhaust. But there is no real comparison between smoking and diesel exhaust. How much is each one responsible? We know that both are not good, but we don't know the exact quantification because it's difficult to quantify how much time a person is getting exposed every day to smoke. But it is known that all the diesel exhausts are harmful and they can be one of the causes of lung cancer. And that's the reason why urban populations are more at risk of lung cancer.
As you have specified all the risk factor, as a patient, how should I understand what are the symptoms of lung cancer?
See, if lung cancer happens, then the first important side effect or symptom means early lung cancer doesn't have any symptoms. 20% of lung cancers are early cancers. They won't have any as such symptoms. But if there is lung cancer, which is in advanced stage, stage 3, stage 4, if your cough is not settling down in 2 weeks, if you're bleeding or if you're coughing blood, if you're having breathlessness, if you are losing weight, if you have headache, if you have got back pain, if you've got any of these things, because the cancer can spread to spine, it can cause you backache, it can spread to brain, it can cause you headache, it can have calcium up, so it can cause you constipation. But mainly it is cough, bleeding through cough, and breathlessness. These are major side effects of the cancer increasing in the lung. So these are the symptoms.
So in day-to-day life, we receive many questions that stress may also have an impact on lung cancer. Is it true?
See, stress doesn't cause cancer directly, but we know that people who are under stress smoke. People who are under stress drink. People who are under stress eat more, so they become obese. People who are under stress do not exercise. People who are under stress do not take care of themselves. People who are under stress do not take treatments properly. So stress may not be a direct factor, but stress plays a lot of role in our day-to-day life. We are behaving according to our stress pattern. And also people who are stressed, depressed are less self-caring, less likely to undergo proper treatment, less likely to take care of themselves, less likely to do so many good things in life.
So, what can be the options which can be there for lung cancer treatment screening, basically?
See, basically, we don't screen everybody, but if you screen patients or people who are at high risk, like supposing somebody is smoking 20 cigarettes per day for 30 years, he falls into a classical criteria of screening. If somebody is smoking 20 cigarettes per day for 20 years and there is a family history in that person's life, so they should be screened. Now, low dose CT is a screening methodology. You just do a low dose CT and it has shown that there is a 20% risk reduction of cancer and death by doing a low dose CT in this high risk group of population. You don't need to screen everybody because then it will be not cost effective. So to make it cost effective, we don't screen everybody. We screen only high risk people who are smokers or people who have got family history, or there are certain population like genetic hereditary population, BRCA1, BRCA2, certain genetic link, smoking history, mining history. If you're working in a mining factory and you're smoking, your risk is increasing 14% every year. So these are high risk people. So you should look at those and then screen them.
As you said, sir, that lung cancer is the treatment can be cost effective related to some patients. So, as compared to other cancers, is the treatment effective, cost effective, or it is very expensive?
Lung cancer can have treatments varying from maybe very uh, not very expensive. So if it depends on basically what you're looking at. If you're looking at lung cancer, uh, stage is important. Early stage, as I said, surgery is the treatment of choice. In early stage, you may require to give chemotherapy. So it is not easy. So some treatments are very expensive, but then definitely we are getting generic drugs that is going to make the treatment easier. We have got immunotherapies which are very expensive, but we have to modify treatments according to patients' budget, what they can afford, and whatever schemes or whatever things we can fit them in. So we try to, but treatments can be very expensive. Some treatments are costing in lakhs for lung cancer. So it depends on a scenario. So if you give me a scenario, I'll tell you how much is the cost.
So, as a patient, if I want to if I am undergoing certain treatment, so what can be the treatment or management options for lung cancer which are available?
Lung cancer basically is treated by multiple ways. If it is an early stage, you do surgery. Now, surgery can be either, it is generally done by a thoracic surgeon who is trained in surgery. And basically, it is a minimally invasive surgery which is preferred for early stage cancers. So you may do a video assisted surgery, VATS, or you may do a VATS lobectomy, you may do a robotic surgery, you may do an open surgery. Now, these surgeries can be either a wedge resection, you remove a small part of lung, or you remove a lobe. Now, there are 3 lobes on right side, 2 lobes on left side. So if you remove a lobe, it is called lobectomy. If you remove an entire lung, it is called pneumonectomy. So you may do a surgery based on that. If your surgery is minimally invasive, a person may recover in 3 to 4 days and go home, and they may go back to work in 3 to 4 weeks. But if the surgery is very extensive, they may take longer to recover. Now, that is the first part of treatment. Sometimes the surgery may not be possible upfront. So you may have to give chemotherapy, shrink the tumor, or give chemoradiation, shrink the tumor, and then take them up for surgery. Sometimes you have to give surgery and then give radiation, or sometimes you have to do surgery and then give chemotherapy and even a targeted drug like osimertinib. Or if the patient has got an advanced malignancy, you may have to go for a targeted drug if there is a genetic mutation available, or a targetable mutation available as a protein. So there can be a genetic problem or there can be a protein problem. You may target one of them. So depending upon if there is an EGFR mutation, ALK mutation, so you may target EGFR with a tablet. There are multiple tablets available, ALK with a different tablet. So there are multiple such targets available, PDL1, ROS, BRAF, NTRK. So you have multiple of these. If there are no targets available, you may have to go for chemotherapy. Now you may go for only chemotherapy, or you may go for chemotherapy with an immunotherapy, chemotherapy with immunotherapy and anti-angiogenic, chemotherapy with anti-angiogenic, depending upon what you're choosing. If you have a patient who has got very advanced malignancy and they are PDL1 positive, you may go only for immunotherapy, or you may add chemo with immunotherapy. If the patient has got a very localized tumor and the patient is not operable for medical reasons, you may take them up for radiotherapy or a radiosurgery. In radiotherapy also, there are multiple new mechanisms of treating them. Basically, if a tumor is, supposing a lung tumor which is localized, it's not difficult to target a lung lesion, but the problem is the lung is moving. So every breath the lung is moving, the tumor is moving, and there can be a significant amount of movement of that lung tumor. So we have what we call image guided radiotherapy. So not only we confirm the radiation beams to the tumor structure or the shape, but we also look at the movement of the tumor and target it accordingly. So the respiratory gating is done, the lung movements are captured, and the machine also looks at the tumor and targets it at a particular profile of breathing. And that's how they can be accurate up to 1 millimeter. So you may do radiosurgery where you cannot remove the tumor. So these are various ways of treatments, and you may have a combination of this.
So you have very wonderfully explained all the treatment options. But as a patient, they fear that there can be sometimes it can be side effects also related to treatment. So how can a patient manage that side effects?
See, side effects are individually planned. Like if there is chemotherapy being given, what chemotherapy I'm giving has a particular amount of side effects or a particular pattern of side effects. We generally tell the patient that this is what is going to happen and this is how you have to handle this. If I'm giving a pill, that also may have a side effect. There may be loose motion, there may be rash, there may be nail bed uh, irritation, there may be blood counts dropping, there may be weakness, there may be fatigue. So we have to explain them that this is how you have to handle, this is what you should inform us, and this is how we are going to take care of things. So the doctor who is treating a patient always knows what are the expected side effects, and accordingly the patients are informed. There may be nausea, they may not like regular food, they may have to go on alternative food. So there may be multiple things. So we have to manage those. If radiation is being given, supposing the tumor is centrally located, there may be an esophagitis. The person may have difficulty in swallowing. So you may have to look at those kind of side effects. If there is a surgery, there may be pain happening in the chest for a month or so. So you may have to reassure the patient that this is what is expected and this is what should be acceptable by patient also.
One thing, sir, which we are hearing from since last 2 years is COVID. So can you just highlight COVID and lung cancer? Is it related or what?
It is not related. See, but basically when COVID came up, there are 1.3 billion people right now in the world smoking. 70% of them want to quit smoking. When COVID came, everybody was scared. COVID and lung, we know that when smokers get COVID, the survival is poor. COVID has no direct relation with cancer. But people were aware during COVID that smoking is not good and they wanted to quit. And they also tried to pledge. 70% of people wanted to quit, but they did not have resources how to quit. Quitting smoking requires proper guidance from an expert. Nicotine replacement patches, they may require certain drugs to get this nicotine addiction off. You may require support groups. So those kind of things are required for smoking related quitting. Now, the thing is, during this period, a lot of people became aware, but now as we are getting vaccinated, smoking again is going to go up. See, in 50 years, what has happened? When uh, people understood that 50 years back, that smoking is not good, there was a big drive in America, and they said that, we are going to get this eradicated, cancer. But this was a failure. There is only in last 50 years, first time in 2016, they found that there was 2.2% decline in smoking related cancer. But it is after 50 years, you're getting a small decline. I would take it positively that it's not bad, but the problem is even different. Male smoking is becoming less now, and female smoking is going up in the world. So smoking is related to 16 types of cancer. There are 4,000 chemicals in it when you smoke. There are 60 carcinogens. So you're inhaling 60 types of carcinogens. You're creating multiple illnesses. There can be illnesses of mouth, larynx. There can be stomach cancer, bladder cancer, so many things. So smoking is not only causing lung cancer, it is causing so many cancers.
Think, sir, during this COVID time, there were many patients who were going for HRCT without even doctor's advice. So do you think that it can also lead to lung cancer somewhere?
Not really, but too much of exposure of radiation is always going to be harmful. And it is not really known that how many exposures are needed to create cancer. But then we do know that patients who have undergone radiation to chest, for whatever reason, they may have undergone radiation for Hodgkin's, they may have undergone radiation for breast cancer, they do have a higher risk of lung cancer. So it is a known fact.
Oh, sorry. So, sir, what can be the possible preventive tips for our patients?
For lung cancer prevention,
Yeah.
if you are non-smoker, do not start smoking, first thing. If you are a smoker, quit smoking. Eat healthy. So eat more fruits, and vegetables. If you eat vegetables, your risk of lung cancer decreases by 3%. If you eat fruits, your risk of lung cancer decreases by 5%. If you run, your cancer risk decreases by 5%. If you are not obese, your cancer risk is less by 15%. So if your diet is not good, that also can promote. So I think there are simpler things. First is quit smoking, quit tobacco, eat well, exercise well. If you are working in a mining factory, never smoke because your risk is increasing by 14% every year. If you are working in a factory where there is an exposure, there are guidelines. Please use those guidelines to prevent cancer or your risk of getting exposed to those chemicals. It may be any of those things. It may be asbestos, it may be beryllium, cadmium, it may be textile industry. Just take care of yourself so you can prevent a significant damage to yourself.
So for those patients who are cancer survivor, lung cancer survivor, uh, how can they live after the diagnosis is done? What are the parameters that they should follow?
Generally, as we said, that follow-up is very important. 5 years, the cancer can come back. So we need to follow them up for 5 years minimum. So even if their cancer is gone and the scans are normal, we do not give up on their follow-up. We keep watching them. That's first thing. Second thing is, yes, they should have whatever was their causality. They should try to rectify those, and they should go on a healthy lifestyle. So if they are smokers, they should quit smoking. Smoking alone is not only for cancer. It will also reduce down the other problems like osteoporosis, heart problems, COPD. You will start breathing well. You will start saving money. You will start feeling better. There are multiple benefits of quitting smoking. And the moment you stop smoking, the benefit starts within minutes. But if you give up on smoking, there's a 39% benefit at the end of 5 years. There's 50% benefit at the end of 10 years. And there is still a risk at the end of 25 years if you are a smoker. So never it becomes like a normal person. But there is a benefit compared to if you continued smoking.
So, sir, taking all this into account, what and when should a patient go for consultant to an oncologist if he feels that if he's is having some symptoms of lung cancer? When should he?
Basically, if a patient is not settling down with this cough for 2 weeks, if a patient is losing weight, if there is a blood in sputum, or if there is a patch on an X-ray, or HRCT has been done for COVID and there is a patch in that which is suspicious. All these are reasons to go to a specialist and get a biopsy done and get a confirmation done and get a staging done, typing done on the particular thing and try to find out whether it is cancer or not.
Since you are here with us, one more thing. Since many of our viewers can be a physician, they can be a doctor also. What advice would you give to them for patients who are coming or symptoms from lung cancer? So what can be the advice which you should give?
Basically, if there are symptoms and you suspect cancer, then get their scan done. Either it can be a CT, HRCT, or it can be a PET CT scan, and get them if you suspect cancer in that. Cancer typically is a speculated lesion in lung, which shows, speculation. If you look at that's the reason why cancer is always depicted as a crab, but it is not a crab. It is just showing spikes, as if a ball with spikes. Okay, so that is how cancer looks very carefully. When you look at a good CT, you can pick up these spikes very easily. And that is usually the primary. You can biopsy them from any of this site. Once you biopsy, then the further testing, whether it is small cell, non-small cell. If it is non-small cell, then the typing, adeno large. If adeno large squamous. If it is adeno, then you have to go for next generation sequencing or a mutational analysis. As I said, you may do it by IHC, or you may do it individual genetic pickup, or there are various profiles available now with various companies. So there may be Sanger sequencing, there may be next generation sequencing, there may be PCR testings, there may be IHC testings. You may do it whichever way you are comfortable. That's fine.
Last question, sir. There are many thoughts regarding to myths of lung cancer. There are sometimes people tell that it is not curable. Sometimes they say that I don't have smoking, I don't do smoking, so I will not get lung cancer. What is your thought on that, sir?
See, as I said, lung cancer is significantly linked to smoking, but non-smokers also get cancer. That they, as I said, they are through multiple mechanisms. The mechanisms being second-hand smoke. See, you're going through a lobby. Somebody has smoked there. You're inhaling that smoke. You're still a smoker. You're going in pollution. You're still a smoker. You're taking arsenic through water. That is also a cancer promoting substance. If your area is undergoing a lot of construction, that is releasing radon gas, that is also a cancer causing substance. If you are taking pesticides, if you are obese, if you are inactive, if you are not doing exercise, if you are not eating vegetables, if you are not taking fruits, if you are taking a lot of non-vegetarian food, all these are cancer causing things. So there are multiple ways of getting cancer. So it is not that if you are not a smoker, you cannot get cancer. A lot of females we see these days have lung cancer, and they ask me the same question, that we never smoke. But smoking is not the only cause. That's what I'm trying to tell you. Smoking is one of the major causes, but non-smokers do get cancer. In last year, in 2020, there were 7,200 cases of lung cancer in America alone, which were related to non-smoking. So in India, we do not have this kind of statistics. So we cannot label that, this is what is happening in our country. But we have multiple other means. We are even having tobacco chewing. We have smoking. We are smoking BDs, hookahs, e-cigarettes, cigarettes, and we have burning the fuel through wood fuel. So we have other means of fuels which are having smoke. We have our trucks. If we go behind it, we have one of the worst pollutions coming out of it, the diesel exhaust, which itself is a cancer-causing substance.
Thank you, sir, for highlighting this. One last question which we have received. Can a blood test detect any type of cancer?
No. Blood test basically right now is not being used to detect cancer, though it can suggest that it is a cancer, but it is not used as a confirmation. So there are multiple means. So you have ctDNA technologies. Now you can even pick up one cell and say that, there is cancer. But these are not being right now used or for treatment. So it is not.
Thank you, sir, for this wonderful time you gave to us. Any final message which you would like to give to our viewers on today's topic?
So this is the highest mortality cancer in the world, and a lot of people die. We are improving on treatment, but we are happy, we are getting new drugs, but we are not understanding that this is preventable. You don't have to get a cancer and prove your therapies are good. You can very well prevent this cancer and say that I am good, which is going to be cheaper, better for our country. So my suggestion is that don't think that you're great if you get a good drug or you create a new drug. That is not great. Not having cancer is really great. And this is one of the most preventable. Everybody thinks that I am not going to get this. So this is not my thing. That's the reason you will find that not many people want to talk cancer. They definitely want to talk. They definitely want to talk of things like diabetes, heart. I just was discussing with my student today that, people talk that I've got 2 stents inside as if they are carrying a gem. This is not the way. You will have to understand that this is not something we want. We want health, but we are discussing diseases.
Thank you, sir, for this wonderful initiative, and thank you for creating awareness among our viewers about the cancer. We will meet again in future. Thank you to all the viewers for also being with us. Please do visit Jain sir, both the channel on YouTube and Spotify. Cancer Talk with Dr. Minish Jain on YouTube and Cancer Ki Baat Dr. Minish Jain ke saath on Spotify. So till next time we meet, on behalf of entire team, goodbye and take care. Thank you.
Thank you.